guess I just have compassion for people. Even when I was a little girl, I always liked to help because, nursing is always helping patients and helping people. So I feel like I'm in the right profession. I used to be a director of nursing of a hospital here in Warren County, a small hospital. I also was a case manager on the weekend. That's why I'm a certified Medicare site nurse. So I learned a lot. I learned a lot dealing with the patient. I did a lot how you all treat patient here. When I was in the Philippines, we don't really pay attention to the site needs of the patient. We're just focused on the physical, but here in America you do. So I have to learn that. So I have to learn a lot because when I came here, I pretty much was a greenhorn from the Philippines. So I have to learn the culture. I have to learn the lingo that the patient will understand, especially in the countryside. Now I've learned to talk like a Southerner, but I still have my Filipino accent. So I have to learn every aspect of caring about the patient. In a home health setting, you get to know the patient more. You see really how their lives is, the dynamics at home that really affect the way they look at their health in itself. So you understand them better, and I feel like you have more satisfaction with the home care because you really see when they progress. Because in the hospital, you see them, they go home, you don't really know what happened to them. So in home health setting, it seems like you really you see that total picture of the patient and the end point of your care. So I like that better. It's busy. You have your paperwork to do. You have to coordinate with other discipline and collaborate what's going on with the patient so as to improve the care of the patient and developing relationship with the family too. So I think that's the difference, and you use your own clinical skills to assess the patient, that you can provide the doctor an intelligent assessment of the patient so they can recommend the treatment for the patient. We are the clinical eye of the doctor, so I think that's why it's so important, because you have more feedback with the care of the patient. Well, in home care, I've seen pretty much all kinds of patients, the wound care patients, you give IVs, TPN, and of course the burden is more teaching them. So that's the difference in the hospital. You didn't teach them, you just do it for them. And I really get more satisfaction teaching them and develop the relationship with them. I think with new nurses, they have to learn to really depend on someone that can teach them and give them a good orientation so they will stay. But I will always tell them that there will be always someone to call. The only thing you need to know is ask questions. So I think they will be satisfied with it more than the hospital because of the flexibility and the autonomy, I think. Especially if you are essentially an independent person, an intelligent nurse, I think they will like home care.